Okay, it looks like we've got someone on as well. Christine, thanks for joining us.
Good morning.
Good morning. All right. So,
Hey,
Jasmine, I'm going to
Christine.
go ahead and kick things off. So, welcome everyone to our Brightly Thrive Workplace Wellbeing April guest speaker series. For those of you that don't know me, I'm Cassie, so I'm one of the co-founders of Brightly Thrive. And today we are honored to have Jasmine Evelyn with us. She is a world-class expert in pelvic health physiotherapy. So she brings a wealth of knowledge and experience in the field of pelvic health and its profound impact on functional movement for not only women, because when we think of pelvic health, we naturally think of women, but for men and children as well. So I think she's really going to kind of open up this whole new door to our health and our pelvic health for just all genders across the board. So her journey into physiotherapy began with her passion for dance during her teenage years and led to her study of physiotherapy at the University of Brighton in England. So it was during her clinical placements that she discovered her true calling, which was pelvic health physiotherapy. And after earning her degree in physiotherapy, she went on to further train in both pelvic health physiotherapy, but also became a registered yoga instructor as well, because that was pivotal in her just health journey and really helps to bring some peace and more zen into her life as well. So not long after endeavoring on all of her training and certifications, she opened up her practice, Mindful Movements. And today's session, which we are calling From the Ground Up, How Pelvic Health Influences Functional Movement, Jasmine is going to not only provide some education on the foundational importance of the pelvis in our daily well-being, but she's also going to lead us through some exercises. So it is a interactive workshop, and I'm really excited to see how she brings all of this together to help us understand the critical role of our pelvic floor muscles in maintaining not only our posture, our stability, but also just overall in functional movement. So I invite all of you to join me in giving her a very warm welcome. Jasmine, we are very excited to have you here. And at the end of this call, I will be dropping a link to your website, and feel free to drop a link to any other resources or any other social media that you want to connect with our employees with.
Thank you. Thank you so much for having me. Yeah. So I'm going to share my screen again. Thanks so much for reaching out. And I was really honored when you guys reached out and asked me to share. And thanks for the introduction. Okay. And you can see everything. All right.
Yes,
Also,
all clear.
is it okay? Can people like unmute and chat with me as well? Or you prefer
Oh
to
yeah,
leave on?
absolutely. Absolutely.
Okay.
So yeah, if you guys have any questions throughout her presentation, this is interactive. So please feel free to just unmute yourself or throw something in the chat, and we can, if you're in the middle of presenting, Jasmine, I'll go ahead and let you know if something pops up in the chat as well.
Okay, great. All right, so thank you again. So the title of what we're going to be chatting about is From the Ground Up, How Pelvic Health Influences Functional Movement. And so, this is my passion speaking about this. I think that if we understand how it influences functional movement, we kind of know how to prevent pelvic floor dysfunction, which we're going to kind of talk about during this session. So our goal is to understand the role of the pelvic floor. So we're going to do that first. And as we go through that, I'm going to highlight how dysfunction might present, a few examples. We're not going to go too deep into it, but so just so you get an idea. The main thing I want us to know is understand that the pelvic floor is a part of our core, right? And then I want us to apply this knowledge to our day-to-day task, which is functional movement. So functional movement means, what do we do to function every day? And when we include functional movement in our exercises, it helps us to function better on a day-to-day basis. Okay, so most people, when they hear about pelvic health physio, they're like, what is that? I think most people know a physiotherapist. We're movement specialists. We assess how the body moves, and we identify dysfunction, and we help you to correct it. Most people think of physiotherapy and they think, okay, I'm going to go if I have pain. But actually, if you're having difficulty doing anything where your body isn't moving optimally, we're the people that you would seek out. Pelvic health physiotherapists, though, we're concerned more with the joints and the nerves and the muscles of the pelvis. But remember that nothing acts in isolation. So as much as we are focused on the pelvis, we just have to look at the body as a whole, right? Which we're going to discuss a little bit as well. So that's what pelvic health physio is. Because of our role, we do work very closely with women through various stages of their life. But I don't really like to call it women's health because, as Cassie mentioned, men also have pelvic floors and pelvises, so they do have pelvic floor dysfunction as well. And children also have pelvic floor dysfunction. So pelvic health physio is usually the best term. So let's dive right in. This is your pelvis. And when you look at this pelvis, I want you to think and observe that you can look straight through it, right? So if I had to look at a bony pelvis, you can look straight through if it's just bones. So I always describe the pelvis as a basin without a bottom, right? Without a bony bottom. So if we think of the pelvis as a basin without a bottom, it means that there has to be something there that's keeping our pelvic organs in place. So if we look here inside your pelvis, you would have your bladder, your rectum, your uterus, maybe a prostate if you're male. But there's something keeping those organs where they should be. And so when I went to physiotherapy school, we learned about the bones, we learned about the muscles, but we never learned about the pelvic floor muscles. It's only when I went on that placement that Cassie mentioned that my educator said to me, they're pelvic floor muscles. And it literally blew my mind because I had never heard of it. And I was like, it doesn't make sense. There has to be something there. And what's there will be these muscles that we're looking at. So this is a female pelvis. This would be if you were laying as a female on your tummy. And so just to orient you, if you can see my mouse, this would be your pubic bone. So if you're sitting and you kind of feel right here, that would be that area. And then we can see this little hole here where you weave from. This would be the vaginal opening now here, and this would be your rectum, okay? You have your tailbone, and then you have your sits bones. And you can see that your pelvic floor kind of attaches side to side and front to back, front to back. And most people think like it's just one muscle that's there, but if you look, you can see different striations, different patterns of the muscle. And so these are different little muscles that are down here that are working for us. And if you peep at me in the corner, I have a model here. So you can see this will be the bones. This pelvis has a rectum and a bladder. I've lost the uterus, but if you look in here, you can see those pelvic floor muscles. So what you're seeing on the screen would be from the bottom or the outside. But if you look here, you can look inside and see them in there as well. Yeah. So your pelvic floor muscles are at the bottom of your pelvis. That is what helps to keep everything in there. Now we're going to move on now to the functions. As you can imagine, the first function will be supportive. So you have rectum in here, you have bladder in here, you have uterus in here. If you're a male, you would have your prostate in here. But then on top of there, you have your other organs, your stomach, your everything goes up, 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 up. So as you can see on this diagram here, your pelvic floor is like a hammock. And on top of that hammock, you have all of your organs on top there. So it has a supportive function. And a really good way to think of it is this example we're going to go through now, which would be a boat in a dock. So if you think of a boat in a dock, a boat is connected to the dock by wires. Similarly, your uterus is connected, or your bladder, let's go with a bladder because everybody has a bladder. If your bladder is connected to your pelvis by little wires called ligaments, right? Now, let's think now of the water with the boat. So if the boat is connected to the dock by wires, then you have this water underneath that gives it some lift and some buoyancy. That is your pelvic floor. So as much as your organs are connected to the pelvis, your pelvic floor gives it the lift and the buoyancy. If we take that away, if we take the water away, there's more downward pressure. The boat can sink. And so your pelvic organs can sink. And that is usually called pelvic organ prolapse, where sometimes you might find, oh, I feel something a little extra in my vagina. You might feel something, you might see something. And that is what we call pelvic organ prolapse. Common in women, doesn't happen to men because women usually have more space here. We have more of a genital hiatus for that stuff to happen, right? And so first role, supportive. Second role is a sphincter. So I don't like to go backwards on presentation, but just for the purpose of this, we're gonna go backwards for a second, just a split second. Look at here. Can you see these little circular muscles? Yeah. So it has a sphincteric role. A sphincter is a muscle that keeps the opening closed. As you can see, this little chicken, she just sneezed and an egg popped out of her bum. And her friends are telling her that she needs to do her pelvic floor exercises, right? So if you can laugh, if you can cough, if you can jump, if you can sneeze, if you can get out of a chair and you don't leak urine, you don't leak gas, you don't leak feces, your pelvic floor muscles are working well for you, right? This can be a little bit more complicated than just your pelvic floor muscles working as a sphincter because it also has a role in pressure control, which we're going to talk about later. So as you do these things, as you cough, sneeze and stuff, and the pressure in your tummy and your abdomen changes, these muscles work with your core to make sure that pressure doesn't go down. All right. Now, your pelvic floor also works with your bladder. So if you were, for example, in this presentation and you say, okay, I want to use the bathroom, I need to wee, your pelvic floor muscle is going to say, hold on, you're in that presentation. Let's wait 2 seconds, and then you can make it to the bathroom. So your pelvic floor is going to give a little squeeze that you're unaware of to relax your bladder so you can make it to the bathroom. And then when you get to the bathroom, your pelvic floor muscles are going to relax so your bladder can squeeze the urine out. So they have this kind of opposite relationship. And sometimes when that relationship gets kind of wonky, then we have issues there, right? It also has a sexual function. So any kind of penetration, any kind of penetrative sex, or any kind of penetration in terms of a pelvic exam or inserting menstrual products, that means that your pelvic floor is relaxing and allowing that penetration to occur. And we take this for granted. So sometimes I see patients where they can't have any kind of penetration, whether it be sex, exam, anything, because their pelvic floor muscles are so tight. And we usually call that vaginismus. But they also have a role in sexual sensation. So the fact they're contracting and relaxing helps you to have things like orgasm. The fact that they will contract to help keep blood in the penis. So an erection comes not only from blood going to the penis, but also from pelvic floor muscles helping the blood to stay there. So they have a really big role when it comes to our sexual function. Then they have a sump pump function as well. So if you have ever visited anyone in hospital who hasn't been moving for a long time, you might notice that their limbs start to get swollen. As we move around during the day and our muscles contract and relax, they actually pump fluid away from our extremities, right? So we need that contraction and relaxation of muscles so that they keep our body, stagnation from happening. And so the pelvic floor muscles do the same. They help to pump and get fluid away from the pelvis, help with circulation. And they also have a role in stability and pressure control. So as you can see, let's look at this diagram here. You can see your pelvic floor muscles at the bottom. This will be your pubic bone at the front, where we said if you touch at the front, that hard bone, and then your tailbone at the back. So as we said, it goes front to back. And then you have your abdominal muscles at the front. And we're gonna get into this on the next slide, but we're gonna chat a little bit on it now. Your diaphragm up here under your ribs and your back muscles, okay? And they help to really give your core stability, and they help to control the pressure in your abdomen. So we're gonna go to the next slide. And this is one of the concepts that I want us to take away. So the fact that your core, so if you stop on the street and you ask anybody, what is your core? They're gonna say my abs, my six-pack muscles. But most people forget, or they don't know, that your core is also made up of your muscles at the bottom, your pelvic floor, your muscles in your back, particularly these multifidus muscles, but your back muscles in general, and then your diaphragm. That's a big one. Your diaphragm is also part of your core. So think of it almost like a can, a cylinder. You have this cylinder in the center of your body that helps to keep everything nice and stable, nice and sturdy. And it also helps to control the pressure in there, which I know I'm talking about all the time, but we're gonna explain it soon.
Yeah, Jasmine, I just really quick just want to say, like, I'm so fascinated by all of these diagrams and like
Yeah,
the even like the cartoon drawing of the hammock, because I'm one of those people where if I talk about my core, I'm thinking my
just
stomach
the,
muscles,
just
like
the
had
front.
no idea about the diaphragm piece and
Yeah.
like looking
Mhm.
at this diagram of how the pelvic floor connects you from the front to the back. Like
Yes.
I've never seen a drawing with an anatomy where it includes that, like I've
Right,
heard of the pelvic
exactly.
floor, but it literally, like, I guess I just thought it was just something that just kind of floated there.
Exactly. That's why, and I mean, as
Yeah.
I said, at physio school, we didn't learn this.
Yeah.
And even, when you hear about pelvic floor, you don't think it's like different muscles and stuff. You don't think it's one, like, as they say, a slab of meat that's underneath there,
Yeah.
randomly. But they are different muscles there.
This
Yes.
is, yeah, this is really fascinating. I can
Yes.
see why you were mind blown. I'm mind blown too. So
Yes. I
this
was
is
very
great.
mind
Thank
blown.
you.
Great. So let us try. We're gonna do a little experiment, and bear in mind that these concepts can be hard to grasp right away. So if you don't understand right away in terms of what I'm gonna ask you to do is okay. That's why we always say if you're having a pelvic floor dysfunction, it's so important not to just like go online and just try to understand from there. It's really important to work with the pelvic physio so they can see what you're doing, give you good cues, actually feel your pelvic floor muscles, etc. But we're going to try to contract our pelvic floor. I'm going to try to relax our pelvic floor and see if we can identify what's happening in our abdominals. Okay. So first of all, I want you to think of so sit upright. If you're sitting, sit upright. And I want you to think of where your anus is. We're going to use the anus because everybody has one. And this is usually the strongest part of the pelvic floor. So normally when I do an assessment, this is always where everybody can connect. So we're gonna go with here. I want you to just think about where it is, right? And I want you to imagine that you were going to just squeeze it. Just squeeze your anus as the first cue, and then just let it go. So that's the most basic cue. And maybe you felt something, maybe you didn't. All right, the second cue I want you to think of is imagine for those of you who like smoothies or like boba tea, I want you to think that you're going to drink, that big straw? Imagine you're going to drink up some boba tea, but with your anus. So you're going with down there, nice and slow, pick it up, suck the drink up, and then release it, right? And you should feel like a little lift, almost like those muscles come away from the chair. And then when you release, you feel them go back to the chair, right? Try as much as possible not to squeeze your buttocks muscles, so your glutes. All right, so hopefully you felt something. Now I would like you to use your hands and kind of find these bones just in the front, right here in front, and then just go in slightly and just press so you can feel the deeper muscles. And then again, we're gonna do the same thing. We're gonna drink up that drink. And what do you feel under your hands? When you drink the drink up, you should feel something happening under your hands and then release the drink. So
Yeah, I feel,
hopefully,
yeah, I feel like like tightness, like a
yes,
contraction, right?
yes, you feel a
Jasmine, can you
contraction.
tell us, is this the same as Kegels or is this a different
Yeah,
exercise?
yeah, yeah. So this is a Kegel. What we
Okay.
just did, when we just squeezed down there, what we did was a Kegel,
Okay.
right? And if you put your fingers in and you squeeze, you should feel like a little contraction under your fingers here. So what does that tell us? It tells us that when we contract down here, here does it as well. So they are related, they work together, right? Now let's try the opposite. And I don't want you doing this normally, but I want you to think again, fingers in that spot. Don't think of squeezing now. Think of like if you want to pass gas. If you want to pass a little bit of gas, and you should feel like a little downward movement of your pelvic floor. And you should notice that your tummy kind of goes out a little bit when you do that downward movement, right? And so that tells us that when we lengthen our pelvic floor, here expands. So they work together. When here engages, and vice versa. When here relaxes, and vice versa. So we kind of understand this relationship so far, and then we're going to add in the top part eventually. All right, so good. Now let's talk about functional versus dysfunctional muscles. Now, functional pelvic floor muscles. So this here, we have a male pelvis at the front. As you can see here, the bladder, and then the prostate is just underneath. And then you have the bowel into the rectum, into the anus. And then here we have the female pelvis where you would have bladder, uterus, bowel. But as you can see, the pelvic floor is basically doing the same thing. Yeah, good. So functional muscles need to contract, and they have and in capitals because that's important, and relax, right? Most people, when they think pelvic floor, they just think I need to do my Kegels, 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 but we need those muscles to also relax. Dysfunction occurs when, and Cassie, can you see the full slide? You can see everything?
Yes, I can.
Okay, good. Dysfunctional muscles happen when our muscles are either underactive, so they find it difficult to contract, and we call this hypotonic, but don't worry about that word, or overactive if they find it difficult to relax, right? And this is often caused, among many other things, by persistent pelvic pain, but there's only one example. So I always use the example of a bicep. If your bicep can lengthen and contract, you can pick up your phone and you can put it to your ear. If your bicep is too long and it can't contract, so if it's underactive, you can probably pick up your phone, but you can't put it to your ear. Equally, if your bicep is too short, your hand can get to your ear, but you can't pick up anything. So you need muscles to be able to lengthen and contract in order to be functional and work for you every day. Same thing goes for your pelvic floor, right? So how can we maintain a good length tension relationship for our pelvic floor? Breathing. And again, I hate to go back on slides, but we're going to tap back really quickly so that you understand. So good breathing helps us to coordinate our core movement. It helps us to recruit our core muscles optimally. And it helps us to relax our pelvic floor. Okay, we're going to explore this now. And the reason I'm going to tap back is so that you can see the diagram from before, which if I had thought of it, I would put it afterwards, but we're going to tap back just for a second. So as I said here, good breathing helps us to coordinate core movement, recruit our core muscles optimally, and relax your pelvic floor. So if we look back here, your diaphragm is at the very top, okay? We just realized that when we contract our pelvic floor, our tummy also contracts, right? Now, when you breathe out, your diaphragm, let me start again. Let's think of your abdomen as a balloon. When air goes in, everything expands. When air goes out, everything deflates. Okay? Now, as you breathe, your diaphragm can influence how your tummy muscles and your pelvic floor muscles move. When you breathe in, your diaphragm moves down. Okay, so let's do here. It moves down. And as it moves down, draws the air in, it creates a little pressure in here because it's not pushed down. What happens here is that your tummy expands and your pelvic floor moves down. So that's on the in breath. As you breathe in, diaphragm moves down, tummy expands, pelvic floor moves down. As you breathe out, your diaphragm moves up, push the air out of your lungs. The pressure in here is not relieved. So your tummy comes in and your pelvic floor moves up. Okay? So by breathing properly and by being aware of your breathing, I'm not talking about every second of the day, but I'm talking about, as we're going to talk about soon, during exercise, during your whatever yoga practice, stretch practice you do, by being aware of your breath, you can get the most out of your recruitment of your core, and you can get the most out of your relaxation of your core. So we're going to explore that now. So we're going to do diaphragmatic breathing. So use your hands like this and kind of cup your base of your ribs, okay? And this can be hard because most people breathe the opposite way. So I want that when you breathe in, you're going to let your ribs expand to the side. You're going to let your tummy expand to the front. And if your back muscles could expand, they would, right? And as you breathe out, you're going to let everything deflate. So we have this inhale, body opens up. Exhale, body contracts or kind of comes in. A good time to practice this if you're getting familiar with it for the first time is also lying down. But what this breath does, as I said, as you breathe in, you will, I'm going to say this again, diaphragm is going to push down, tummy is going to open up, pelvic floor is going to open up, right? This is useful for if you had any kind of pelvic pain. That will help your pelvic floor muscles to relax, focusing on those inhales. Constipation, when we want our pelvic floor muscles to relax, for the stool to come out, that kind of breath is going to help everything to come out. Then as you breathe out, everything deflates. And if you were trying to engage your abs, that's the best time to engage your abs because as you exhale, everything wants to contract anyway, right? So let's do a little experiment now to further kind of explain and explore that concept. We're gonna go one more time, as big a diaphragmatic breath as you can. So breathe in as slowly and as expansively as you can. Make that breath really big. And then breathe out. Good. Now I want us to go back to the first thing we did together, where you squeeze your anus and hold it. For me, it's just squeeze your anus, suck up the boba drink and hold it, and then let it go. So what we're gonna do now, I want you to try keeping your pelvic floor contracted and see if you can breathe in as much as you did the first time when everything was relaxed, okay? So you're gonna squeeze your anus, hold it, so suck up the boba drink, hold it, and try to take a full breath in while you pull your pelvic floor up. And what you should notice is that it's harder to get that expansion if your pelvic floor is clenched, right? Because as we just said, your pelvic floor is part of that breathing system. So as you breathe in, your pelvic floor wants to lengthen. So it's hard to keep it squeezed when it's trying to relax. We can also
Jasmine, can I interrupt you real quick?
Sure.
So this is again so fascinating. Is there anything that people should be aware of while they're doing this that would kind of cue them into the fact that they do have pelvic floor dysfunction? So like if they're without like engaging our pelvic floor doing the diaphragm exercise, the diaphragmic breathing, is there anything that would cue them into, okay, maybe I do have something going on, just to kind of bring a little bit of awareness to,
Yeah, so
these exercises?
usually with the breathing, normally if you find that it's very hard, it doesn't mean that you have pelvic floor dysfunction, but it means that you will be more at risk of it. And I'll explain why. So if you were doing this breath and you realize, I feel like when I breathe in, I'm sucking my tummy in. And when I breathe out, I'm poking my tummy out. What that says to me is that when you go, and especially if I see someone and I say, okay, engage your pelvic floor, and they go, I'm gonna engage my pelvic floor and inhale at the same time. Or I'm gonna engage my abs. As I say, engage your abs, let me see. They will inhale and suck in their tummy at the same time. It means that when you're out in the wild and you're lifting something heavy, you're going to inhale and do it, which means you're not going to be getting a good pelvic floor or core contraction if you're inhaling. And it says to me that you're likely then to probably not control the pressure in here properly and then end up having a pelvic floor dysfunction. Or if somebody comes to me and they're leaking urine, and I say, okay, let me see you engage, and they're doing it on the inhale, it means that they're not getting good recruitment of these muscles. Do you understand? Is that clear?
Yeah, no, that makes total sense. Yeah, I
Right.
was just kind of thinking about, okay, what does this feel like if it's like, what does the good part feel like? But then compare that to what might be
Yeah.
a cue as to something that's not in
So
alignment.
a clue into something that's not in alignment would be when you breathe in,
Mhm.
you suck in your tummy, or when you try to engage your abs, your ribs flare out. So those things would cue to me that there's some kind of compensation sometimes, or it means that you need to work on your breathing pattern so that you can then recruit your core properly when you are, as I said, lifting something, when you're sneezing. Imagine you're sneezing. When you're sneezing, that's an exhale. So you want to, when you sneeze, Your diaphragm moves up, your core engages, tummy comes in, pelvic floor goes up, so that all the pressure comes up through your nose. But if you're not breathing properly, generally, you have a breathing pattern that we call it reciprocal breathing, where, as I said, you breathe in and try to engage. When you breathe out, your tummy is letting go. So when you sneeze, everything is letting go, and then you get a leak because these muscles
Gotcha.
are turning on.
Okay, that
So
makes
the
so
way a
much sense.
person,
Thank you.
yeah, so the way a person breathes can tell you a lot about how they will recruit their core when they're doing a strenuous exercise or a sneeze,
Okay,
off a laugh.
thank you
Good.
for that.
So we did that experiment. Next up, we can see that your posture. So Cassie, you mentioned posture earlier. Posture is really key and way your posture can affect how the position of your diaphragm over your pelvis. It can also, because the optimal alignment would be, and there's no perfect posture. I always say there's no perfect posture, but you don't want to be in one position for a long time. Okay, so we don't expect you to be like upright 24/7, but you don't want to be in one posture all the time. And people get stuck in a particular posture. And then when that happens, their diaphragm isn't lined up over their pelvis. If you look at this chappy at the top, you can see here that his abdominal muscles are lengthened and he has a little pooch here. And that isn't like, sometimes a pooch isn't body fat or anything. It's literally just abdominal pressure and the way how you're standing up, right? And so if he had to align a little bit better, you notice that his tummy muscles will probably not look as distended. And this posture here is a posture where, as you can see, look at his lower back. He might probably have some lower back pain if he was lifting something or in general. And imagine if he had to sneeze or cough here, the pressure that will build up in his tummy if he was somebody. And men generally do not have incontinence randomly. It would normally happen after abdominal surgery, but this is something that will cause an increase in his intra-abdominal pressure, the pressure in his tummy. And it's something that would affect the way how his core is going to work. So if you are in your chair now and you slump your body and you try to take a big breath in, is not going to be as much breath in because your diaphragm isn't going to be able to move as much as if you were upright. And if your diaphragm isn't moving, it means that your pelvic floor isn't moving and functioning properly. Those two, as I said, all three of them, they work together. So posture is key. It impacts how your muscles work, and it can result in patterns that can be uncomfortable. So again, here we have this diagram here in pink, where you can see you don't want your body to be too arched, because if you're arched and you're lengthening your abdominal muscles too much, it's going to be hard to recruit them. And then if you are lean, if you're like hunched over, again, your abdominal muscles are creating too much pressure in the front. And that can lead to even how we talked about the prolapse earlier. If you have a prolapse, you don't want to be in a posture like this, because then it's going to put already too much pressure going down, and it's going to almost change the length of your pelvic floor. So you want to think ribs over pelvis. And this is something that I also tell new moms, because usually, because they've just had a lot of lengthening of their entire core, they tend to stand up like this person is holding their baby, and you find that they end up having back pain, etc. So you want to think rib cage or pelvis. Clear?
Yes, absolutely. I wished I would have had somebody teaching me about posture after having children, because I was definitely in the first category
Yeah.
there.
And then the thing is, when you have, so sometimes with pregnancy, you get a diastasis, you get your abdominal muscles separating. And then when you're in one of these postures here, it's very hard for those muscles to really heal or to be recruited properly. And so
Mhm.
posture plays a role on how the muscles work, but sometimes how those muscles work, because they're weak, sometimes puts you in that posture. So it's about finding a balance and kind of correcting it through muscle strengthening and muscle lengthening.
Jasmine, in your experience, because these examples, these resonate, definitely resonate with me, but also in your experience, can you kind of speak to the role of sitting, like being sedentary, or like, because I mean, we are in a workplace, right? Many people sit at a desk and sit at home at a desk. So how does that play into this as well.
Yeah. So similarly, in terms of sitting at your desk with like a slump posture, we just did that. We just did if you were sitting like this all day. But also think about your pelvic floor muscles, what's happening in your hips. So remember I told you everything is connected. So your hip joint, so this is your pelvis, this is your hip, this is your leg going into the hip socket, right? So what is happening in your hips affects what's happening in your pelvic floor. Same way how I said what's happening in your core, in your abs, affects what's happening in your pelvic floor. Same thing goes for your hips. So if you are seated for a long time and your hip flexors are getting tight, normally if somebody comes to me and they're like saying, I do have pelvic pain, you know, I do have some pain with sex. Obviously, we know it's not just from sitting, but sometimes when they say, yeah, my hips are really tight, like when I go to yoga or when I do whatever, I know my hips are tight, that can be, you know, an indicator that your pelvic floor is also going to be tight. And so sitting a lot, you want to think, I need to maintain the length of my muscles. So you want to do things to oppose that. So not only with the hips, but if you're like this, your rib cage is closed. And we just said we want as much rib movement as possible to get good movement in our core. And so you always want to think of doing things that are going to do the opposite effect. So opening up the chest, strengthening the muscles in the back, and then doing things that would stretch your hip flexors, stretch your abdominals, things like that. And so sitting and how you sit can affect the length and the strength of your core.
Wonderful. Thank you for just shedding some light on that for us.
Good. And you know, nobody's meant to sit for hours. So it's
No.
always good to get up and move. I always tell people, put your water bottle across the room and go to get it.
Oh,
So you
that's
get a
a
break.
great idea. That's a great tip. Yeah,
Yeah,
thank you.
you're welcome. So another good thing to help us maintain this length tension relationship or a good length tension relationship would be exercise, right? Strength training and stretching. It has to be a balance. So you sometimes strength training, and especially so if you have a pelvic floor dysfunction, we realize that it is that your pelvic floor needs to be strengthened. So the reason why it's good to have an assessment by a pelvic physio is because sometimes you might be leaking urine or having an issue and you think, okay, I need to do my Kegels. But we just said dysfunctional muscles can be too tight. So if you're doing Kegels, you're making your problem worse, right? So you need to be assessed to make sure, okay, yes, your muscles need to learn to tighten so we can do that, or actually no, not tightening. You need to relax your muscles in order to get better. And sometimes when people are leaking, sometimes just relaxing those muscles can solve the problem, and then you move into strengthening and making the muscles more functional. But you never want to just be doing Kegels because we just said that, you know, everything is connected. We talked about the hip muscles, we talked about the diaphragm. We need to get everything working together. And sometimes learning how to breathe and engage those muscles with, but not sometimes, all the time, learning to breathe and engage those muscles with movement is best. And moving and working other muscles, because that's how we work, that's how we live. When you are going about your day-to-day, you're not thinking about Kegling, right? You're thinking about moving your body and getting what you have to do done. And so what you need to do is basically do your strength training, do your stretching, because we just said the muscles need to be long and short and to have a balance. But let me just move this a minute so you can see. Right. And what this does is it helps us to maintain our activities for daily life, especially as it relates to changes in pressure and stability. So remember I said, sometimes I may have people who leak when they get up from a chair, or they may leak when they pick up a child, or they may leak when they pull a table. They may leak when they, you know, I think I have it now, right here, or close a window, when they laugh, when they lift. So the reason why you're doing this type of exercise, the reason why we're going to go through these exercises shortly, is because we want this movement and this awareness to translate into our everyday life, right? So your pelvic floor, so in these, let's just talk about these functions here are the areas where we want our pelvic floor to be able to, or our core in general, to contract, to prevent pressure from going down. So if you're lifting something, as I said, jumping, closing a window, laughing, pulling, pushing, those are places where your core will engage and you're not thinking about it and you don't have a problem, which is great. But for some people, they might pull something and feel, oh, I felt a downward pressure. And that might have been the start of their prolapse. People think prolapse happens just because you had a baby and just because you gave birth. No, you might be lifting incorrectly, lifting and holding your breath. Yeah, so these are things in our day-to-day lives where our pelvic floors work for us all the time. This is just a small example. And then in terms of toileting, remember I said this is where you want your pelvic floor to relax. This is where your core is nice and relaxed. So if you were on the toilet, you want to be doing, especially if you suffer with like constipation or difficulty getting stool out, you want to do your slow diaphragmatic breathing and putting a step under your feet. So if you go on YouTube and watch this squatty potty video, they have a video where they
Yes.
explain,
They
yes,
have the best videos.
the best video.
The squatty
It's
potty,
about
yes.
unicorns having a pool. It's entertaining. So
Absolutely.
yeah, so the reason why that works is because it actually, so here you can see this rectum has a little kink. When you move, when the pelvic floor muscles relax, you don't have to push the stool down that little swirl. It's just nice and straight. And then you can further help that by taking those slow breaths. Remember we said if we breathe in, everything expands, the bottom expands as well, and the stool comes out easily. And then we also need those muscles to relax to allow penetration, as we said, for sexual function or any type of pelvic exam. So those are things, for example, that it does in your day-to-day. How can we be aware of our core during exercise and in our day-to-day life? And this is not something that you need to be hyper fixated on, but you can be, it's something as simple as learning how to coordinate your breathing with your movement and avoid breath holding. So if you don't remember anything from today, think avoid breath holding when I'm doing my activities, especially strenuous activities. Yeah. And I'm hoping that by the end of this, you'll be able to, if you go to the gym, you'll be able to say, okay, so with this exercise, I should do this, or with this exercise, I should do that. That's one of my aims. So sorry, I am having difficulty seeing. Give me 1 second. Good. By learning to breathe and coordinate breath and movement, that is important. That is key. I always say that even if you have a pelvic floor, if you could squeeze your pelvic floor and hold it for a year, that is not as functional as if you can engage your pelvic floor and your abdominals on a breath out. That is what is going to make your pelvic floor functional. Some people can squeeze and hold forever, but they can't recruit those muscles with the rest of their core. That pattern that they work, their pattern of a core recruitment isn't optimal, and that is what you need. So we're going to go here and we're going to look at the core breath. We went through this already, but I put it here just for reinforcement. So as you can see here, when you inhale, there's 360 expansion of the abdomen and the pelvic floor. Right? We said the abdomen will expand. Don't worry too much about this arrow here with the diaphragm, because what happens is I said the diaphragm moves down and that creates the pressure, right? So the diaphragm moves down, but that creates the pressure here where you get this nice lengthening, which is useful if we're doing exercises like pigeon stretches in yoga. If we're doing a hip opener and we do our diaphragmatic breaths and really focus on our inhales, that helps us to get the best out of our pelvic floor lengthening. There's something called, as I mentioned, vaginismus earlier. And there, let me just step aside for 1 second. There's something called dilation. So sometimes when people are having issues with penetration, they use these things called dilators, right? And sometimes people say to me, I've been using dilators, but they're not working, right? The way how a dilator works is that you will insert, they're very small, they start very small, and you insert it into the vaginal opening. And sometimes you can only get in a little bit at first, and then you say to me, it's not working. But the reason why it's not working is because you're not using your breathing. If you can use your breathing and breathe in and let those muscles expand and relax around the dilator, your success is much better. Same thing as if people are having tight hip muscles and they're stretching, it's not. Breathing is key. As you breathe, those muscles are going to expand and you're going to get the most out of the stretch. Equally, when you exhale, there's tensioning in the abdominal wall and the lower back, and your pelvic floor shortens. So if you want to engage your abdominals, the best time to do that is on a breath out. Right, so we're gonna try that now. So again, you're gonna use your hands like how we did earlier in this space. And we're not thinking about our pelvic floor right now. We're just thinking about engaging our abdominals. Most people will just suck in. I don't necessarily want you to think of sucking in. I want you to think I'm gonna breathe out and I'm gonna draw here together. So I'm gonna breathe out gently and draw those sides together. And you should feel a tightening there. And I want you to try it one more time. Breathe out, bring those sides together, and maybe you feel a little something here. Because remember earlier we did this and we felt here. Oppositely, if you do here, you might feel a little something here. What you don't want to feel and how you might know. So Cassie, this is answering your question from earlier in the opposite. If you engage your core muscles and you feel a downward pressure here, like you feel these muscles moving down or you're having a pull, you're engaging your muscles incorrectly. You're just squeezing in the middle like a toothpaste tube, and then pressure is going down on either end. So if you find that, oh, when I engage my abs, I feel downward pressure, no, that's not good. And then when you go to engage your abs and add weight or stress, that pressure is going to be greater. Okay. All right. So when you engage your abdominals, you should feel a little something or maybe nothing, if anything, in your pelvic floor. All right. So we're going to move. So one of the best things you can do for your core function is thinking, let me make sure that my rib mobility is good. You might rib mobility, thoracic mobility. Thoracic is like your upper back, right? Or your middle to upper back. So this would be your neck, cervical spine, and then below there to about here would be your thoracic spine. So the reason why this is important is because your diaphragm attaches into your ribs. So the more rib mobility you have, the more your ribs can expand, the more your diaphragm can expand, the more movement and mobility we have here. And we know that mobility means good function, right? So we are going to just have a quick wardrobe change, not literally. I'm just gonna push this back a little bit so you can see me in the distance a bit. And we're going to do some exercises generally that are gonna move our spine in all 6 ways. If you think of moving your spine in all 6 ways, that is really going to be good for your thoracic spine and really good for your mobility of your pelvis. So if you have your chair, you can sit upright in your chair. And I'm going to just be moving around so you can see me from different angles. The first thing we're going to do is a cat and cow. You can do this on the floor as well. But the reason why I chose chair exercise is because I know most of you probably were at this, and it's really good for you to just incorporate in your day-to-day, right? So hands on your knees, and I want you to think, if I'm doing this, my body is expanding. So this is where it's a good time to inhale, because you know inhales mean expansion. So you would inhale, kind of arch your back, kind of arch from here, and maybe look up a little bit. And now our body's gonna contract. The front of our body's gonna contract, so we're gonna breathe out, tuck our tailbone under, and around our spine. So we're gonna do 5 of these. So inhale, take your time, look up, and exhale, round your body. And now as you do these, use your entire inhale to move through your cow position. And then use your entire exhale to move through your cat. So don't let all the breath go at the beginning and then move. Try to really get the movement coordinated with the breath, right? And then round, keep going. I think we should have about 1 more to go. But physios can't count. My patients tell me this every day. But all right, so 5 it all. If you're still going to take your time, but really feel that movement as you move through the tube and really take your time with it. Now we're going to add a twist. So we're going to kind of cross our arms. So take your right arm over to your left knee, and you're going to open up on your left side. So again, we're opening our body. So this is where we would inhale. So you're going to inhale and open up. And then exhale, begin to twist right across. Inhale, open up. And exhale right across. And if you were doing this on the floor on your hands and knees, you would come through here. All right, we're gonna go again, inhale. And exhale. Last one, inhale, open your body. And exhale, we're gonna switch sides. So put your left hand on your right knee. And we open up the right arm. Inhale, open. And exhale through. Inhale. And out. And breath in. So move at your pace. If you find you have more inhale, you stay open. And then whenever your exhale comes is when you will start your twist. And then last one, inhale, open up. And exhale through. Now we're going to do some side bends. So you can just keep your hands on your lap. We're going to reach your right arm up. So inhale, reach up and think about stretching and opening it on this side. And then exhale a little bit in the side bend. We're going to switch sides. So inhale, reach up on the other side. And when your exhale is finished, it means it's time to exhale. When your inhale is finished, it means it's time to exhale and go over. We're going to do one more on each side. So inhale, lengthen. And exhale. Take the last one in your time. So inhale for as long as possible. And then the exhale takes you over. The last one is going to be a forward fold. You can do this standing, or again, you can do it seated. You're going to literally exhale and roll down, all the way down, as far down as we can. Touch our toes or the floor. And then we're going to inhale to roll up. So as you come up, your head should be the last part to come up. We're gonna do two more. Exhale, roll down. And inhale, come up. One more. Exhaling down. And inhaling up. Good. So I find that these type of exercises where you try to connect breath and movement like this, it also helps you to extend your inhales and extend your exhales, especially if you're thinking on an exhale, you want to do a movement. If you're used to moving and coordinating, that is going to be easier to do it, as I said, in the real world, right? Now, functional movement. If we think of a squat, and this can be a tricky concept to get, because again, most people do it the opposite way, but we're going to think a squat can equate to a sit to stand, right? So we're gonna look at me first. If I am standing up, if I'm sitting down. No, something that's hard to get because you're doing it and it doesn't feel strenuous. I always say, imagine if you had something heavy. So imagine if you had a weight, right? What is the hard part of this? Getting up with it or sitting down with it? Equally, if you were doing a squat, the hard part of a squat, is it going down with the weight or is it pushing it up? If you have a really heavy weight. And the answer is you need the most muscle engagement and pressure control when you're coming up, right? So you would, if you were doing a squat at the gym, you would exhale, inhale, exhale, inhale, right? And I find that most people do it the other way. They would inhale and then exhale to bend and go down. But really and truly, as I said, you're thinking I have to use my muscles to help keep everything strong, to control the pressure as I stand up with this weight, right? Muscles are working still when you bend, but not as much as when you have a push-up. Now also a deadlift. So deadlifts are good because you have to lift and pick up things off the ground all the time. Granted, we don't do it in a deadlift mechanism. So you wouldn't want to be picking up something heavy and doing that. But in practicing your breathing properly, something like a deadlift, when you go to lift a child or lift a heavy package or a box, you would understand how to recruit these muscles. So equally, Cassie, you can see me?
Yes.
Okay, good. So equally, if you were doing a deadlift, it would be inhale here. I exhale and come up, right? Even better if you were able to exhale and engage those core muscles we showed you earlier. We can bring here together. Rowing.
Yeah, this is great because it seems counterintuitive, but now knowing everything that you've told us about how everything ties in from the diaphragm down to your pelvic floor, this makes so much sense coming from a
Yeah,
functional movement perspective. But yeah, this is such good information, Jasmine.
I'm glad. So rowing. So rowing is a good one because I'm not talking, it doesn't matter. It could be rowing like this, or it could be rowing if you had a resistance band pulling. Same thing, you have to control, breathe out and engage your abs as you pull to you. And I don't expect, as I said, I don't expect you to be pulling something in your day-to-day life and thinking, oh, I have to do this. But if you are working, if you're exercising at the gym, if you're moving your body and you're thinking about it actively in the gym, so you're rowing, you exhale, pull, inhale, release, exhale, pull. When you're doing it, pulling a table, it's gonna be automatic, right? It's going to, your muscles will kick in. If you are, if you're not exercising at the gym or wherever, and you find that, oh, when I pull, I feel the downward pressure, or, you feel a leak, you know that when you pull, you need to breathe out and engage those muscles, okay? Overhead press. So overhead press is the same thing as putting something in a cupboard. Putting something higher, right? Same thing, you will breathe out, push, inhale, release, exhale, push, inhale, release. And again, you're thinking of engaging here. And this is important. These kind of things are important, especially for people who have pelvic floor dysfunction, where the core is not coordinating properly. They'll have to be more aware of this in their day-to-day. Lunges. So just like a squat, we pull this down a little bit so you can see me over here. Just like a squat. Remember in a squat, we said inhale down, exhale up. In a lunge, it would be the same thing. Inhale down, exhale up. And lunges are important because that helps us to get off the floor, right? A lunge is a one-legged or a staggered activity where you have a lot of weight distributed mainly on one leg. And this is like us walking, right? Walking is a one-legged activity. You balance in one leg to the other. So this is why lunges are good. And the reason I chose these particular exercises, as I said, because they translate into day-to-day life. Any questions so far on this?
No, I'm like super excited to implement like the breathing piece into the mobility piece because I think, yoga, it's kind of ties in, right? Like, especially if you have a great yoga instructor, they tell you about, incorporating the breath work with the movement. But I think a lot of people forget about that with the functional movement or even in the gym, that aspect, and how important it is. I think, you're just shedding a lot of light onto.
And what you said is right. At yoga, you get those cues, but at the gym or CrossFit or wherever, you don't get as many cues. And sometimes people don't even think about breathing, or they would say, well, I'm gonna hold my breath to lift this weight because it's gonna create this core pressure. No, you need to breathe out so that you don't have that pressure. So for example, quick example, I had a patient recently, a male, who was having these hemorrhoids that wouldn't go away. And they started when he started doing core work every day. He's doing his core work. So imagine a crunch. So you're doing a crunch. and you're either holding your breath or inhaling, imagine how much pressure is going down. So you need,
Yes.
if you're doing a crunch, you need to think, okay, inhale down, exhale, engage. So things like that. So just teaching how to like engage here properly with the breath was the way how we solved that problem. So breathing is so key. And it doesn't mean that you have to, I mean, as a physio, I think everybody should have a little exercise routine if it's just 10 minutes, even if it's just 10 minutes. But I
Mhm.
know not everybody has that time. And so even if you're doing these activities, especially if you find that you have an issue, sometimes the place to start is, oh, am I breathing when I do this? Am I holding my breath? Is the first place to start? Or am I breathing out? Am I breathing in appropriately? Right?
Love that. Yeah. And Christine said, I've enjoyed learning the breathing. It makes a lot of sense and something I don't think
Good.
about. And so, yeah, bringing
Good.
that consciousness to that, the
Yes.
breath piece. Yeah,
Yes.
absolutely.
And the other thing is, and we're gonna be finished soon. I could talk about this all day, as you can tell.
I
But
can
I
sit here
promise you, we're gonna
and
soon be
learn this
done.
all day.
We're soon gonna be done. But the other thing is when you're doing that breathing, you want it to be nice and controlled. So nice breath in, control, breath out. Not say, because if you say, your tummy does that. So you don't want to just say and then you don't want it to be like a because sometimes people do that, then it creates that downward pressure. So if somebody's constipated on the toilet, it will tell them breathe through a fist. And that creates some safe downward pressure. So I don't want you doing these activities and blowing. Keep the breath nice and controlled when you're doing it, right? So in conclusion, your core is made up of your diaphragm, your abdominals, your back muscles, and your pelvic floor, right? These muscles work hard for us every single day. And taking care of these muscles, including your pelvic floor, is important. And one of the ways you can do that is simply by breathing when you do your activities. Even if you walk away from here, like, is it in, they're good. If you look for pelvic PT on YouTube talking about breathing, all this stuff will be there. Or if you look, but you have the recording anyway, you can go back and see. But breathing is key, then learning how to recruit those muscles properly, right? And it's always good to work with a pelvic physio, pelvic health physio. So that is it. This is, so I have my stuff here if you want to connect. This is my website. I don't look like this anymore. I chop my hair off, but this is my website. This is my Instagram. I do a mixture on Instagram about pelvic health and education, and then I try to inspire people to move their bodies as much as they can, because that is the key. Yeah,
Yes,
and that's it.
absolutely.
I'm done. Thank
Well,
you so
thank you
much.
so much, Jasmine. And yeah, we've got someone else that says awesome information. Thank you so much. And yeah, this has been
Thank
fascinating
you.
and super enlightening, and it ties in so well with our workplace well-being program.
Good.
So we've got someone that teaches yoga on Thursdays. So for
Yeah.
those of you that are joining this call or watching the recording, Roy Roundy teaches yoga at noon on Thursdays, both virtually and in the gym. And then on Mondays, Tuesdays, and Wednesdays, we have personal trainers available that can walk you
Good.
through those functional movement pieces. Definitely talk to them about what you learned today about tying in the breathing, because they are well trained around that as
Yes.
well. And
Good.
this has just been so fascinating. And Jasmine, before I let you go, we know where to find you. I dropped your website into the chat, and we've got your Instagram here as well. But from your experience, how often, because at the beginning of the talk, you had mentioned, people typically will go to a physiotherapist when they're in pain, right? But you're talking about taking preventative action and working with a
Yeah.
physiotherapist to, really work on your alignment and like your breathing if you're going to start bringing more movement into your life. So, how often do you suggest people meet with a physiotherapist in order to bring that component into their lives, as well as like add to their healthcare team, right?
I think so. I think it's based on you. So you go first to your physio. If you think you need it, as I said, it's good to, especially if you wanted to get into exercise. Let's say you say, you know what, after this, I would love to go and do some CrossFit or whatever. Let me meet with my movement specialist, my physio, and let them look at my body. Let them say, okay, these are the areas that you need to work on. This is stuff to be aware of at the gym. Your glutes or whatever is a little weak. So make sure you modify this exercise. Don't go too heavy on this. Don't go too heavy on that. And then they'll say to you, come back to me and how much ever. So they will decide with you what's best. So it's really a one-on-one thing. No one of my patients has the same protocol as the other. So some people come once a week, some people come every like 4 weeks, some people come more often. It all depends on, that first visit, or maybe sometimes even the second visit, especially with pelvic health. Sometimes this, well, not sometimes, all the time, the subjective, that history is so important. And pelvic health visits are usually much longer than the average visit. So usually from like 45 minutes to an hour, especially for the first visit, so we can get all of your history and go from there. But I would say it's really good to have a physio in your back pocket, and it's really good to have a pelvic physio, especially if you've had any kind of abdominal surgery. I find, I don't know if it's just a Barbados thing, but if you had a knee surgery, you would go to physio.
Yes.
But with abdominal surgery is like, okay, bye, you're
Yeah.
free. But
Right.
yeah, if you've had like a hysterectomy, if you've had a prostate surgery, if you've had fibroids removed, anything like that, any kind of laparotomy, so downward cut,
Yeah.
anything like
C-sections.
that.
Yes.
Yes, and
Yes.
postpartum, during
Yes.
pregnancy, I would say it's good during your pregnancy. If you know you're thinking, well, I want to get pregnant maybe before, so that you can learn to start implementing these principles, because the more you do it before and during your pregnancy, the much easier it's going to be for you to recover and build some muscle memory for postpartum.
Wonderful
So
advice.
that was a long answer, but talk to your
No,
physio
it
and they will,
it
yeah.
makes sense. We're all bio-individually unique and we've got
Yeah.
different health histories, so that makes total sense. A little bit more love in the chat. Thanks, Jasmine from Corelli. And then Christine, thank you so much for your time. Great information.
Thank you guys for coming.
Yes, Isha, hopefully I didn't butcher your name. Isha or Isha, also love your Monstera plant, she says.
It has 2 new leaves.
Oh, they're beautiful.
It just came
Well,
out
thank you
today.
so much, Jasmine. And yeah, if you guys want to follow Jasmine on Instagram, she has great content that she puts out. And you can also go to her website if you want to reach out with any additional questions that you have. It was so wonderful having you, Jasmine. Thank you.
It
All
was wonderful to be here. Thank you all.
right.
Have a
Take
great
care.
rest of your week. Bye-bye.
Bye.